This is what meningitis can look like, but in this case, it was a little bit different than what the doctors expected. Normally, to diagnose meningitis, you have to put a needle into the lower back and get cerebrospinal fluid through a procedure called a lumbar puncture. The lumbar puncture will typically show you whether or not there's bacteria in the cerebrospinal fluid, and that is an indication that a person would have meningitis. But when this came back negative, the doctor noticed that the patient tested positive for enterovirus through a nasal swab. There is a version of meningitis called aseptic meningitis, which is otherwise known as viral meningitis. The doctor started her on an antiviral medication, on an antibiotic, and also a steroid medication. And after some time, the patient felt much better. Now, meningitis literally translates to inflammation of the meninges, and the meninges are the covering that are on the surface of the brain, and they're comprised of the dura mater, the arachnoid mater, and the pia mater. One way that doctors can identify meningitis is through the Brudzinski sign. This is when you put the patient flat on their back and then you put their chin onto their chest, and if their knees bend upwards, it means that this is a positive sign, which means there might be meningeal irritation caused by meningitis. Alternatively, you can perform the Kernig sign, where you take the knee and then you try to extend it in an upright fashion. Any sort of hamstring resistance might also indicate meningeal irritation. If you've ever had any experience with meningitis, I want you to comment below and let me know what happened.